Hello, everyone. I see people jumping in here. Welcome. We always give a little minute here at the beginning as people kind of trickle in and technology starts to work or decides to not work. So we'll just wait a little bit as people are able to get in. Thank you for coming. We're really excited about our third webinar for this summer series. And got lots of people coming in. Great. Welcome, everybody. Awesome. Okay, I'm gonna get us started. Go ahead and kick us off. Um, the beginning part is a little bit of introductions, so we'll slowly get through that, and hopefully we'll have some more people trickle in as we go. So, welcome everyone. Oh, I realize I'm already here. I wanted to show you, this is our home page, our home slide. Welcome to this webinar, Your Health and Wellness on Campus here at Lewis and Clark College. We're really excited to have you here, and the panelists we have are incredible experts, so experienced. We're really excited. They'll have a lot of great information to share with you, and hopefully be able to answer some questions that you might have about anything related to your students' health and wellness or your personal health and wellness if you're a student coming to us this coming fall. So I will, our agenda for today, I'll start off and we'll do some introductions. We're going to hear from the Student Counseling Center. We're going to hear about the Health Promotion and Wellness Office. We'll also hear from the Student Health Center and from Case Management. And then at the end, we will have a Q&A opportunity. So this is a webinar, and there is an option for you to ask questions in the Q&A feature in Zoom. And I just want to encourage you throughout the webinar to feel free to ask your questions as they come to mind. We will, of course, have time at the end to make sure we get to them, but sometimes as we're hearing information, questions come to mind. Know that you don't have to wait until the Q&A at the end. We'll start to see those questions trickle in. Maybe we'll answer them in our information, but if not, we will definitely get to them at the end during that time. So I'm gonna start us off. I'll introduce myself first. Hi, I am Melanie McManaman. I use she, her pronouns, and I am the coordinator of the first year experience. We are putting on a lot of the onboarding and checklist information, all your tasks. We're kind of the central hub that's sort of communicating that to all of you over the summer. And we work with all of the offices that need a lot of this stuff and information from you throughout the summer before you arrive. So I will pass it off to Robin next, if you can introduce yourself.
Absolutely. Good afternoon. I'm Dr. Robin Kyler. I'm the Associate Vice President for Student Health and Wellbeing. I'm also a psychologist and the director of the Counseling Center, Student Counseling Center here at Lewis and Clark. I'll be speaking today about both the student counseling and health promotion and wellness because we're in a transition of leadership in that office. So you'll get to hear from me on two departments. I'm going to pass it on to Jess.
Hi, everybody. My name is Jess Kingsbury. I also use she, her pronouns, and I am a nurse practitioner and the medical lead for the Student Health Center on campus, which is our medical clinic. I'll pass it off to Gabby.
Hello, everybody. My name is Gabby Herman. I use she, her pronouns. I'm a case manager, which I will describe later, but I'm within the Division of Student Life here at the college.
So we're going to start off with our Student Counseling Center. Go ahead.
Right. Well, we'd just love to let you know that we do have mental health psychotherapy, consultation, and support and skills development through the Student Counseling Center at Lewis and Clark College. All of our services are confidential. The same laws apply to us for confidentiality as would apply to any licensed mental health professional in the state of Oregon. We are staffed by licensed mental health professionals from various disciplines. And we also do have a training program. So we have advanced graduate trainees who are either working toward their doctoral degree in clinical psychology or their master's degree in professional counseling. And our approach is to try to meet each individual student and to meet the needs that they come with, or to help make care recommendations for them if we feel that they would be better served by resources off campus. And I'll talk about that in a little bit more detail. We do really want to make sure that we have access for as many students as possible. And so really often the students coming into the counseling center on campus are most commonly meeting like every other week for therapy. And for many, we do a shorter term, time limited, intermittent therapy. So they may return in another semester or another year, but we don't necessarily have many, if any, students who are receiving long-term weekly therapy year over year with the same clinician. And so we will speak in a little bit, I will speak in a little bit about what we recommend if someone is really seeking um, that level of intensive long-term therapy. But because of the nature of our breaks for winter break, spring break, much reduced staffing over the summer, and students often traveling from campus elsewhere, we find that having more of that intermittent time limited model meets the needs of most of our students. We are generalists, but we are also specialists in college counseling and are very connected with this wonderful group of individuals here and many other professionals across campus. And so we do encourage people to consider utilizing the Student Counseling Center for those mental health needs, but we know that some people need a higher level of care than we can consistently offer on campus. We are fully confidential, as I mentioned earlier. Anything that someone would need to be would keep in confidentiality a licensed mental health professional anywhere in the state of Oregon. Same laws apply to us. So even though we are a part of the institution, our records are completely locked down, with the only exceptions of that really are designed by the state over our licenses to make sure that we are addressing any risk, to any high level of risk to a client or to someone else that client might pose a risk for. And so there are some exceptions to that confidentiality, which would be the same with any mental health professional. One kind of nice bonus of starting on campus to see whether we're able to meet your needs is that there is no cost beyond your student health student health and counseling fees and your tuition, and that covers everything. And so to meet with a licensed professional or an advanced graduate trainee who's under the supervision of a licensed professional for no cost is a pretty good deal. We do have a little fee if you no-show an appointment, but we're fairly flexible. And so we let students know, we know sometimes you space it. Just let us know before the end of the day and we'll consider that a cancellation. And so other than that no-show fee, there's no cost. And we also do provide services to our faculty, staff, other students, and family members who may be concerned about a student, and they're trying to decide how to share those concerns with that student, whether to be concerned, how to make sure that they know the resources to be able to provide that student. And so we are available and happy to offer that consultation for anyone associated with our community to make sure that we can support the health and well-being of our students. We also do provide crisis and urgent support in the counseling center. What that looks like is that during weekdays, we offer same and next day urgent appointments. So if someone is feeling in crisis or something has just come up that is hard to hold until the next scheduled appointment or before they can get an initial appointment, we're available. They can just drop in and speak with one of our therapists who's available at that time. We hold the afternoon open for that every weekday. We also are a confidential service. And so sometimes if someone has a crisis or needs some urgent support for a student who's not interested or actively seeking out our support at the Student Counseling Center, or if it's after hours or on the weekend, overnight, we do have a program that we call the Welfare Intervention Network. And you'll hear more about that when we get closer to new student orientation. But the Welfare Intervention Network, or WIN for short, is a group of professionals on campus who receive reports of concern, and that group has weekly meetings, and we discuss who might be the best person to reach out to help that student understand the resources available to them, to help them navigate things on campus that might be a barrier for them, or to help them find resources off campus if we can't meet their needs on campus. Actually, you'll hear from Gabby a little bit later. She does a lot of that outreach, and she's really good at it. And that also would go for students if we're concerned about immediate safety concerns, that if it's certain hours, obviously our campus safety would be the and in conjunction with our on-call network of professionals would intervene. But the Welfare Intervention Network is the one who would do some follow-up with them. So after hours, campus safety is great. The Welfare Intervention Network, if it's not an immediate need, or we also have a 24-hour crisis counseling service that provides the opportunity for students to meet with to talk on the phone with a mental health professional to ensure safety and well-being if it's times when the counseling center is closed. And all of those services are available throughout the year. I mentioned earlier that I would say, what are some things if you're wanting weekly long-term therapy? Maybe by long-term, I mean like from when you set foot on campus, you think that you would really feel comforted or supported or best treated by someone who is the same therapist that you can see possibly weekly for 4 years while you're finishing your degree. And that's not something we necessarily are going to be offering on campus. Also, if you want very specialized therapies, like you want a really pure dialectical behavior therapy or EMDR, or you want someone who's a specialist in working with someone with an eating disorder. If you want a very specialized therapy, we have people on our team who can do some kinds of therapies, but we don't necessarily have really pure approaches to really specialized therapies, and our scope of practice is limited, so we can't treat everything for everybody. So we can consult with you about that and let you know what we can offer, but you might want to find a specialist in the community. Or if you're looking for psychoeducational or neuropsychological testing, for instance, you would like testing for autism or ADHD or a learning disability, or you're wanting psychiatry, then for these kinds of concerns or desires, we really encourage you to meet with your insurance company early or get a list off their website for current providers in the Portland area, or if you're open to telehealth anywhere in Oregon, that your insurance company will help to support their preferred providers and start to contact those providers early, because if you're wanting these kinds of services, sometimes there are wait lists. And so we encourage you to try to start to contact providers soon. I listed if you're planning to have our college sponsored health insurance, it's Pacific Source, specifically the Navigator version of Pacific Source. And I put the link there for the student insurance. But it is it is a good idea to start early if you're wanting these kinds of services. Um, we also have a really lovely page about off-campus referrals and how to what kind of questions to ask, how to determine if you found a good provider for you. There's some really good resources there, so we encourage you to check that out. And if you need some support with some personalized referrals or access, you'll be hearing later from Gabby, who I'm going to just mention a lot during my conversations with you. And Gabby's really good with helping to identify a few ideas about referrals off campus, and that could be for medical specialists or for mental health specialists, psychiatry, for special populations or specialized care. And so you can really get those referrals from Gabby, you can get them from the counseling center, or you can get the health related referrals from the health services. But we really encourage you to be thinking ahead on those, and if you feel like it'd be good to land with a treatment program in place, that the summer is a good time to do that. If you prefer, or you don't know yet, you prefer to wait and see what we can provide on campus, I do encourage you to go ahead and schedule an initial consultation with the Student Counseling Center for Mental Health. For individualized guidance and treatment options, we'll meet with you for half an hour, just get an idea of what's going on. And then there's a whole bunch of possibilities. It might be that you would like to join us for individual therapy on campus. It might be that you'd like to join one of our groups. It might be that really therapy isn't what you're needing so much as other supports that we can talk with you about on campus. Or if it's that we would recommend more of that specialized care, then we can help you get referrals off campus. Okay, still me. I'm going to talk about health promotion and wellness now. Shifting gears, I want to sort of put a totally different hat on. We are waiting for our new director of health promotion and wellness to join us in mid-July, and she'll be here and ready to go when the semester starts. And her name is Jenna. But for today, I will speak about health promotion and wellness. This office is one that provides resources, education, and prevention programs that concern the needs of Lewis and Clark students and humans. So we do a lot of work on interpersonal violence prevention. We have advocacy services, talk about sexual health and answer questions about that. Work on choices around substance use and trying to reduce the harm potential of substance use. Talk about body image, nutrition, sleep hygiene, stress management, all kinds of things. And the health promotion and wellness team comes out onto campus, into classrooms, into student organizations, and just provides a lot of information, resources, and education so that you can build your understanding of health literacy, promote healthy decision making, develop skills, and have a place for some support if you're struggling with any of these concerns. It's very important to know that the health promotion and wellness team are our kind of education and prevention arm. The Student Counseling Center is the mental health, and you'll hear soon about student health, which is the medical health, physical health of our various wellness offices. And the health promotion and wellness are not mental health or physical medical providers. So they don't provide treatment, diagnosis, guidance on mental or physical health in terms of identifying disorders or concerns or challenges someone may be having. And so that's an important thing to know. There is one exception. I think it's on the next page. Next slide. Yeah. The one exception to confidentiality, so that since they're not treatment providers, they're not confidential. So if you come to talk with them about, I'm struggling with sleep, and they say, oh, we're going to have a really cool program on sleep hygiene, why don't you try that out? And also, I think maybe it'd be helpful for you to talk with someone at the health center or the counseling center, depending on what's going on. They could actually talk to us about your conversation. They're not going to do that without your knowing it, but they can do that because they're not confidential. The exception to that is when they're serving as confidential advocates. In the state of Oregon, confidential advocates are privileged professionals with a lot of training and who provide advocacy and support for people who have experienced um, um, partner violence, they've experienced unwanted sexual contact or sexual assault, or they're experiencing gender-based violence or harassment, and that when talking with them specifically in their role as confidential advocates, that is completely confidential, privileged information, and they cannot speak with anyone without your written permission, just like at the counseling center or the health center. So that one piece is where they're confidential. Otherwise, they're not. They do provide peer education and health promotion programming. And so if you're interested in peer education, please come down and talk with us. We would love to have your involvement. They also offer RISE, which is an alcohol and other drug harm reduction or recovery kind of support service. And RISE stands for Reflect, Inform, Support, and Empower. And it's not to tell you what to do or what not to do, but just to help you make good choices for yourself. You will hear from us in mid-August, and this is a really important point. So I went the first one last. Is that you will be receiving an email on July 15th that's going to give you guidance and a link to go to a webpage to sign in to complete some required online educational models. These are several. I think there's 2 for you all coming in. Nope, there will be 3, but 2 from us and 1 from another. There are 3 programs that you'll need to complete, and these are either federally required or state mandated, and they are on hazing, prevention, they're on substance use education, and they're on interpersonal violence or sexual assault prevention. And so you'll get information about all of those modules. You will have a deadline. You will need to complete them. So please watch for that. And my recommendation is that it would be really lovely if you did those before you showed up on campus, because you're going to be busy and tired with lots of great social activities and educational activities and orienting activities during NSO, and you will need to have these done by the end of NSO. So at least I know 2 of the 3. And so I encourage you to do those early and get them all under your belt before you show up. Okay, that's me. Thank you so much and welcome.
Hello, I'm Jess. I'm taking over. I'm the nurse practitioner at the Student Health Center. Get started. Okay, so the Student Health Center operates like a medical clinic, so it's more than a nurse's office. We have medical provider staff who can see patients, see students, diagnose, treat, order medications, order tests. So we operate like a regular clinic, so you can think of us that way. Our hours will be 8 to 4:30 in the fall for the whole year, and we will be closed on Wednesdays. So note that with Wednesdays, you could think of that like a weekend day. So if you have a health need that comes up on a Wednesday or a weekend day or after hours when we're closed, there are other resources off campus for healthcare. So we're not in a healthcare desert. We are in Portland, and care is close by even when we aren't open. So the providers we have on staff, we have 2 nurse practitioners, we have a doctor, we have a nurse, and we'll have a medical assistant in the fall. things to know, a really wonderful thing similar to the counseling center is that visits to see us as clinicians, the visit themselves are free. If we do other things beyond talking, doing an exam, making a plan, then there are charges. So if we order tests, whether it's a test that's done in the clinic or sent offsite for processing, there are charges that are associated with that, and we'll talk about that in a moment. If we prescribe medications, there's charges associated with that, both in clinic and then at the pharmacy, where you can use your pharmacy benefit. We do have some vaccines, and so if you get an immunization at the health center, there's charges. And then if we do procedures, which we would go through any of these charges before things happen. So it's a shared decision making. It's not like, it shouldn't be a surprise if there's a charge that is assessed to your student account. And that brings up the next bullet, that we do not bill insurance. So unlike traditional medical clinics, we don't bill insurance. So the charges that you incur from health center things that I just listed, those go to your student account and then are paid on that student account side. The few exceptions would be if we send labs out to our Quest lab, which processes labs offsite, they will bill your insurance. And then if we order things like imaging or we refer you to a specialist, they will likely bill your insurance directly. Common things that people come in for, the most common I would say are people are sick or they're hurt or they need a prescription. So we can help you in all of those ways, which is really nice. So some of the tests that we offer in the clinic include things like COVID tests, flu tests, strep test, um, let's see, mono, urinalysis if someone has symptoms of a UTI or bladder infection. So we can handle some of those acute things. We can diagnose them and we can even treat them within the clinic, because mainly what we stock in our medications that we have on hand are antibiotics. So that's the main category of medicines we have on hand. If you have other medicine prescription needs, like a mental health medication or gender affirming hormones or asthma medicine or skin care medicine, those things all go off campus to a pharmacy and are processed off campus. Touch on the labs a little bit, prescriptions. We do a pretty limited number of these, but we do offer the ability to have someone receive allergy injections at our health center. There's a lot of some rules around that. And so if someone is on allergy injections and they anticipate that they'll want to continue on those, they need to be on their maintenance dose and they need to have an appointment first. So it's not something you can come in and just get right away. There's a process to it. So contact us very early in the semester if you're looking to need that service. And then we also coordinate, kind of similar to Gabby in some ways, but with a different lens. Maybe we refer people off campus regularly as well and coordinate those referrals. And so if we see someone and we determine that they need assistance with this by seeing a specialist, then we can actually send that referral out and send your insurance information with that as well. And then other things like getting imaging, radiology, someone needs an x-ray. We do not have an x-ray machine or any imaging machines on site. So all those orders go off campus and we talk you through how to get connected and how to get that test performed. Okay, so similar to Robin, I've got some things you can do over the summer, some things that are required, and then some things that are strongly recommended. So the first thing that's required, and maybe everyone's done this already, that would be so great, who's listening right now, but the first thing that's required is making an account on the health information portal. So that is your medical record student side that you can look at, and that's where you'll enter your MMR immunization dates. That's where you can schedule appointments, some types of appointments. That's where you'll complete your health history form and other forms. There's a lot of things that you can do on the health information portal, but step one is to make that account. So please make your account ASAP. And then once you registered, then you can start on the to-dos that are required. So the next thing being the MMR immunization requirement. So that is a state mandate. It's not our choice, it's the state's rule. And so we are here to ensure that everyone is protected against measles specifically, everyone in our community. And so Once you have that account, you'll log on and I'll show you some screenshots of what that page will look like, where you'll input those dates. It's just you putting in the dates. It's not you uploading images. It's just selecting on a calendar the dates that you received those vaccines. And there are some rules related to when you got your first dose and when you got your second dose. So just be sure to kind of read the information on that screen. And then there's related to this, to make your life easy when you come for NSO, if you can do this now, soon, before you get here for NSO week, doing the MMR immunization, putting those dates in, then you'll save yourself time. Because if you haven't done it, then you're going to get sent to us. It's going to be a whole thing. And we got to talk through. We got to put the dates in. It'll be a drag. So let's just skip that and put in your dates now, and then you'll be good to go. And then some recommended things that are optional, but nice to do on the front end if you can. The first thing is the health history form. That just asks a few health history questions, and then we gather information like what medicines you might be on and what allergies do you have, medication allergies. So that's just a nice thing to have done on the front end. If you don't complete that, then your first visit at the health center is when you'd complete it. So it will get done eventually, but if you're ambitious and you want to do it now, awesome, then we'll have it on file. And then insurance information. So as I kind of referenced earlier, there are a couple of times where we send your insurance information out with things. So that's with Quest Labs and with referral coordination papers. So if you know what insurance you'll be using in the fall, and it's comparable to the student health insurance, you can put that information in now. If you're anticipating that you'll have the student health insurance plan, that information doesn't usually become available until sometime in August, and so you can't put that online yet. But have these things on your radar, do what you can now, and it saves you work later. Okay, so now we're getting some examples, pictures. So this is what the health information portal looks like, the home screen. You'll see some arrows there to the immunizations tab, the forms tab, and the insurance tab. And I'll show you more screenshots of what to expect on those pages and where to look and where to put information. Okay, so immunizations, the most important thing, the required thing, is putting in these dates. You'll first see the type of vaccine that you received. So most people have gotten the MMR vaccine. Some get these separated out and they just get a measles vaccine. So whatever type of vaccine you got, you select that as a category, and then you'll want to put in your dates, make sure the whole date is correct. Sometimes we get people who put it in as this year, 2025, not realizing that they got to backtrack to the year that this actually happened. So put in the dates. They both need to have been received after 1 year of age. And so there's that first requirement. And then the second requirement is that the second dose needs to be given at least 28 days after the first dose. So both doses after age 1, and then 28 days after the first dose is when the second dose is due and meets the requirement. And actually, could you go back, Melanie? One other thing, once you meet the requirement, you'll see this required, and you'll see measles with the green, everything's green, check, yay. That will happen after we've verified it. So that likely won't be an instant thing. That'll be like a few days out. So if it'll likely be red when you start, yellow when it needs to be verified, and then green when you're good to go. So just kind of keep your eye tuned to that. And that's when you see that, then that means you come off of our list. We have a list that's ongoing on the back end that you will get really annoying frequent messages that say, hey, you need to put stuff into the health portal, MMR vaccine dates. So once you've met this requirement, you'll stop getting those messages. So another reason to just take care of it as soon as possible.
I'm just going to jump in really quick because there's a question. Do I need to turn in insurance information even if I'm not going to use the health center for any of those costs? And I'm just going to quickly answer that for everybody. No, this is optional, but it does just make it easier if something does come up where we might be helping with a referral or sending out a lab.
Now we can move on. Okay, the next thing just illustrates this forms page. At the top of the list is this health history form, and that's what you'll click. There'll be another screen that comes up, which I didn't capture in a screenshot, and then you'll just fill that out, submit, and then it will stay as part of your health record, and we get to see it on the back end, which is really handy when you come in. And then the last thing is the insurance tab. And so yes, as Robin just said, this is optional. This can be done when you come in for the first time, if you ever come in. It just saves time there. We've had some instances where people don't have this information when they come in, and then we're trying to order labs or send a referral, and it just kind of delays the care. And so maybe the biggest thing to know is just that I always bring my health insurance card when I go for a medical visit. And so that way, at least you've got it when the time comes that you're seen, or if you put it in advance, then it's just kind of sitting there and living until we need to pull it for some reason related to your healthcare. Okay, and then quick touch on just after hours advice and care. So when we are closed, students, all LC students have access to this thing called the nurse consultation service or advice line. So it's staffed by nurses. It's not us. It is no one from the college. It is someone third party offsite, but they are all trained nurses in and skilled in triage, which means they hear a health concern and then they have protocols and pathways that they can follow based on answers to questions to help decide and give you a recommendation of, oh, based on what's going on, you should go to the ER, or oh, here's some home care things you can do, or go be seen within a day. So they help you make that decision of how serious is this, and what can I do, what should I do now, when we are closed specifically. So after hours, weekends, holidays, that's the time when you'd use this service. You also can always use your personal health insurance nurse advice line. A lot of plans have these now, and you'll be able to find them. Many insurance cards will have this listed somewhere, or it's on the health insurance website. And it's a great resource. So you can be empowered to take an active role in advocating for yourself by getting care and advice when you need it, and getting it from a professional instead of who knows what, like online. And then when we're closed, and even when we're not closed, sometimes we direct people to urgent care for some reasons, or the ER, and we have a list of these local options on our website, and that just might be a good thing to have saved or referenced, I don't know, somewhere, or know that there's always Google, there's always maps, and you can just map yourself to the closest urgent care or ER if that need arises and we're closed. And then the last thing is this company called Dispatch Health, and they offer what's called a house call service. So someone, actually a medical provider like myself, would come to you physically to your dorm and be able to do a visit there. So this isn't a service that a lot of people use often that I hear about, but it is a nice thing if you're feeling like, I'm not feeling well enough to go anywhere, but I'm not feeling like I need an ambulance. It's not an emergency. If you're kind of in that gray zone and we're closed, this could be a nice option to be seen, have someone physically come evaluate you, a medical provider, and they can do usually some little point of care tests, so a little rapid test, maybe they might have a swab that can test for flu and COVID and RSV or something, and they can give you advice and make a plan, prescribe medicines, that kind of thing. So this is nice. It's also it's not paid for by the college, and it's not paid for by all insurance plans. So don't count on that. You want to make sure this is kind of a part of your coverage benefits before you get a big bill and have to deal with that. So check into it before you'd actually use it. Yeah, question. I don't know if do we want to get into any questions right now? Oh, I think there's just one more. Well, we will continue to cover. So there's a question about being double covered, basically. So having an out-of-state insurance and also having a student health insurance. I'll take a stab at this, Robin, and you can chime in as well. We do get a lot of questions about health insurance, and we are not health insurance professionals, but we obviously are in that world, and so I will answer my best. So a few things to know. So with the student health insurance plan, any tests that are performed in the clinic are completely reimbursable, which means that the student, the parent, whoever, can submit a receipt and get paid back 100% for whatever the charge is, whether it was a test or a medicine or a vaccine, anything that's done physically in the health center, you'll get paid back 100%. And so that's an example of using the student health insurance first. If it's out of state, I think that would be on a case by case, or sorry, if it's off-campus services, that might be on more of a case by case basis. My experience with that is usually that like the better plan gets billed first, and then if there's still a balance that's owed, then a secondary insurance can be billed. And then also under this is sometimes out-of-state insurance plans don't work in Oregon. So it kind of depends on, is it a Medicaid plan? Is it a state specific plan? In some other way, like some Blue Cross Blue Shield plans are very state specific and don't actually have coverage in Oregon. So it might be worth checking to see if your personal or like the non-student health plan, if that one allows coverage in Oregon, and that would answer one of the questions. If it does allow coverage, then it'll be probably a direct conversation with whoever's doing the billing, which won't be us.
I would add, to be certain about this, it would probably be to either talk with our student health insurance professionals, which are not us. I know it's confusing because it's health, but our health insurance is administered separately, or your insurance company. But what I would say is I have heard that if the student health insurance is in the name of the student, which it would be, that one would be billed primary, and then the backup would be the family insurance as a secondary. But you may be able to verify that. The one nice thing I will say is our student health insurance is excellent coverage, and is there's a very broad base of providers in the Portland area and throughout the state who are happy to be paneled with Pacific Source, and so the coverage may be better with that one. But I would double check with your insurance company and with student health insurance here on campus to ask if there's a way that you need to present that so that whichever one you'd prefer to be primary is selected first.
I see a question here about prescriptions. Would now be a good time to answer that on the Q&A? Is that okay, Melanie? Okay. Okay, so it says, how do we transfer prescriptions? Does it change for out-of-state students? So this is nuanced. Depends on the prescription. Some prescriptions and some providers send prescriptions across state lines. There are regulations around this, so controlled substances can't be sent across state lines as prescriptions electronically, but some medications can just be sent to a pharmacy out of the state. I do this, and so I'll send prescriptions. Someone is on an acne medicine, and I can send it to Texas where they live, and they'll be over the summer, so they can keep getting their refills over the summer. So depends on who's prescribing and what their comfort is and what their state laws are related to prescribing. And then if someone wants to transfer it and have us be the prescriber while students are here, we're happy to do that in many circumstances. There are some limitations, some medicines that we don't prescribe. So controlled meds, we generally don't prescribe controlled medications. The one exception is testosterone, but otherwise we're not prescribing opiates, we're not prescribing narcotics, we're not prescribing stimulants. So if that's the prescription, then there's some work that needs to be done to figure out how to get those prescriptions filled in the state of Oregon. But if it's something else that's birth control, let's say, then we're happy to take over that prescription while someone's local in Oregon, and then kind of navigate how to get refills during breaks and closures and things like that. Sometimes it's helpful to still keep in communication with your home provider. So just because you move here and we can serve as a primary care provider doesn't mean we're not open, we're not open year round. We have winter break and summer break and all those things. So it's good to still have your foot in your state, your home state, and your foot here, and we can we'll work together to make sure you don't run out of medicine, but make sure it's the most seamless thing. And sometimes that means actually your home prescriber just continuing to prescribe your medicine, and you see them for regular check-ins when you're home on vacations, if that works. It's very individualized, and so usually when people want to transfer their prescription, they need an appointment. So they come in, they talk to us, and then we help them navigate help them decide what's going to work best for them individually.
I think I can decide just the thing that I've seen most difficult to transfer across state lines is stimulant medication. So if your student is on a stimulant medication, kind of figuring that out, talk to your prescriber now to make sure you can have that seamless transition. Some people opt to get new providers while they're in Oregon specifically who are on stimulant medication, and pharmacists actually have quite a bit of autonomy in Oregon. So there can be some pharmacists who are more likely to fill or not fill if it's coming across state lines. Is it my turn? Hello. Really excited to have you and your student join the Lewis and Clark community. Well, my name is Gabby. I'm the case manager here at Lewis and Clark. And I think when I say case manager, a lot of people think like Department of Human Services type situation. But case management has actually been a part of higher education since the early 2000s after Virginia Tech. And it really is a solution-focused and collaborative approach that works to identify and support students who are experiencing obstacles to their general well-being, their academic success. While here, so kind of a simple way I like to describe it is case management here is about connection, collaboration, and coordination. So I help students either by referral, so other offices might point a student my way, college advising, help and counseling. We work together often. We'll send someone my way to try to find connections and care off campus in the community, or just to help navigate on campus systems as well. So knowing what's on campus, what's available, and basically how to use college resources to the best of their ability. And also help students kind of make a game plan to engage in those and stick to it as much as possible. So the things that it is not confidential, like the health center or counseling. So I can talk to collaborate with other Lewis and Clark staff and faculty if there's a reason. Sometimes students want me to loop in a professor or loop in their college advisor or someone in residence life. So I will often do that with students, is kind of get the team together to figure out kind of what needs to be done for their support. However, I'm still covered under FERPA, so I won't talk to external folks, including parents and guardians, without release of information with the registrar. I do not do therapy or counseling. That's not my thing. I like to send folks over to our counseling center, as well as help them find off-campus folks. I don't do accommodations, no academic or residential accommodations. I don't do tutoring, and then I don't do things for you. We do things together. I like to tell students like we're on a team now and we're gonna get it done together. Some common reasons people come to see me are, like Robin was saying, those referrals to long-term weekly therapy for your entire duration, or a more specialized provider, right? You're looking for this one specific modality, DBT only. Okay, we can work together to find that. Referrals to psychiatrists, referrals for ADHD, autism, or learning disability testing. I help students navigate insurance a lot. So how do you call? What do you say? What do you ask your insurance company to try to figure out what resource you're able to access? And then just some general, problem solving, goal setting. I like to, help students navigate this new life that they're living here, how we can figure things out together. And I actually am a 10-month employee, so I will be leaving so soon, the end of this week, but I'll return at the beginning of August. So feel free to contact me, I'd say in August. And we can meet and talk before you get here if you want to, or come see me when you arrive. I think there's another question. I think about prescriptions, yes.
Yes, so testosterone is a tricky one. In my experience, step one, I think, would be to talk to the prescriber about the prescription part of things back home in Oklahoma. In my experience in Oregon, people can transfer a testosterone prescription, which is controlled if it's not the first fill on that prescription. believe I've seen that done a couple times. I'm not 100% certain. So that technically it's a controlled medicine, and so it is hard when it's if it can't cross state lines. So I would first navigate this with the prescriber and see what they know, what they understand about their state laws, and if it's transferred to a pharmacy, usually it's kind of a intra-pharmacy is the best experience. So a Safeway to a Safeway, that can be more smooth versus, and it's just kind of like they pull the prescription versus there's also transferring from one pharmacy to another, which I haven't had a lot of experience with that, but I've had students say that they've successfully transferred it from a Costco to a Safeway. I don't know how that looks or works on the pharmacy end of things. So I would first, that part I would talk to the prescriber about and try to make a plan for how we're gonna do this. We do have many students who are on hormones and who are on testosterone, and we prescribe testosterone. So that is a common one that we do take over and can follow. We have only so much capacity to do those visits to an extent. So it's we're kind of mindful of that as well, just as far as access goes and all the other student needs that are on campus. But we try to work with students who have run into snags like this can happen. Then the labs, we do have, a lab that can draw blood, and then we can send it to the Quest lab for processing. Our lab also takes outside orders, so a student could come with their physical order, or it could be faxed to the clinic, and then our lab person can draw that blood and then send it to Quest, and it actually just goes and results in that provider's queue or gets faxed to that provider who ordered the test, which might be out of state. So that's a nice service that we offer where we have this draw site essentially where people can get blood draws from off-campus providers as well if they have an order. Hopefully that answers the question.
I just want to chime in and say thank you to everyone for all this incredible information, and encourage you all listening to drop any questions in the Q&A. We are happy to answer any questions you have about this information. We've already gotten a couple in the chat, but we can also answer in the Q&A, typing or live. I want to say there may have been one question. Oh, there was one other question about prescription migraine and asthma meds likely being filled and picked up off campus.
Yes.
Yeah.
Yes,
Okay.
so both of those medicines would be filled off campus. We don't stock ongoing medicines for those types of health concerns. So that can be a case where sometimes a prescriber from out of state could send a prescription locally, so someone could get refills locally. Sometimes getting medications delivered by mail is another nice option in college, depending on the medicine. If it's not a controlled medicine, that's great. And then they just, I know even like Amazon has medication options now. So there's different services, and CVS has a big mail order service as well. So there are some mail delivery options. So that might be nice if getting off campus feels overwhelming. There is the PIO bus that transports people to the closest pharmacy, which is a place called Fred Meyer. And then also near there is Safeway, which is another grocery store / pharmacy. And then we have other pharmacies that are nearby as well, accessed by public transportation. So it's possible to get off campus for these, but there's also mail order. That might be nice for those types of medicines.
And if you enroll in the student health insurance, they do have an integrated mail order option as available as well.
One thing that if you've got Kaiser, that you'll have to go to that Kaiser pharmacy. They're a little far away. So I would see if you've got Kaiser and you're going to be using that here, to definitely do mail order because the pharmacies are difficult to get to from campus.
I can answer, I think, the question about the insurance waiver that is opening soon and will be available until September 16th, but we encourage you to do it early. There's not a lot, it's a fairly short form initially. You will need your insurance information, so your card and who is the subscriber and all of that. But my understanding is that it's a fairly straightforward form to complete. It may ask a few questions about the general coverage, and then that will be reviewed, and you'll be notified either that they defined the two comparable, the air insurance comparable to what's required here, or they will let you know that they don't find it comparable. You still would have an option then to appeal and have that looked at more closely through our health insurance administrator, Jeremy Lowe's. Um, and so that's why we encourage you to do it a little bit earlier, in the, in the couple of months leading up to school, so that if there are any questions and you want to appeal it, that you have plenty of time to go, and follow up on that. Um, and um, and the most important thing is that the reason we're asking for it to be comparable is because we want to make sure that you don't find yourself out of state here at Lewis and Clark, and then you find out your insurance doesn't actually have any providers in this, in Oregon, and you can't really get anything other than emergency or catastrophic care. And we have unfortunately experienced that people come and they think they've got coverage and they don't really have anything besides hospital coverage. And so we do want to encourage you to check that out. I do not think it's a difficult form to complete.
Thanks, Robin. It looks like there is another question in the Q&A about the cost of insurance. I believe I dropped the web page in the chat, which has a lot of information about the health insurance, but I know that the health insurance does cover the summer break. And I believe it is just under, yeah.
It'll be from about August 15th through the following August 14th, and then if you pick it up again, it's all year. So even after you graduate, it ends up holding through a few for a little bit into the summer while you're transitioning. The cost, I think I would encourage looking at the website, because I'm not going to quote it correctly.
Mhm. Yeah. We are coming to the end here. I want to just give one final call out to any questions, and I'll wait as people possibly type them in. Otherwise, I'll also give a little shout out for our next webinar. And that is happening a week from today. And we will have people from our finances, or from the offices of financial aid, as well as our office of student accounts. So they will talk us through a little bit of billing, payment, all of that fun stuff. The cost, we do have one more question, cost of coverage per year. Is it billed per semester, I think?
Yeah, it's billed, each semester is half of it. Yeah.
Great. Hey, any final thoughts before we head out? Yeah.
We're
Okay.
very excited to welcome you to campus, and we look forward to meeting you.
Yes, thank you so much for attending, and we will see you soon. Mhm.